Increasingly, the framework for thinking about innovation is going to be more broadly how value is being created, or actually how value is leaking from the healthcare ecosystem today. And so, how you take into account patient-specific goals as well as clinical outcomes, but also the economics and the quality for the ecosystem as a whole.
In the future, the payers and the people who actually pay for this, and the doctors who are actually going to prescribe this, and quite frequently the consumers who will actually use it, are going to be much more involved than they ever were before in framing what the innovation is going to be, what it's going to look like, what it's going to cost, how it's going to work. In the future, what we're really going to be talking about is that for this particular type of patient, this innovation does something to extend their life, to make their life better, to somehow improve the life of a specific patient. And the value to the patient will actually be defined differently than just safety and efficacy. It's going to be defined in terms of what they can do, the kind of lifestyle that they can have, and the things that they can do in their life or not do because of the particular therapy that they've chosen.
I'm personally a believer that in the future, as we move into kind of really more of a facts-based messaging marketplace, that it's going to be evidence, it's going to be transparency of evidence, it's going to be understanding things at a therapeutic area level. The whole conversation is really going to be one that's driven around a complete picture of the performance of products from a clinical standpoint, how well they do from a safety standpoint, and then ultimately a understanding of the economic impact that they make, not just simply from a unit cost standpoint, but really from impacting the burden of disease and doing things to help cure and improve the quality of patient lives. And I think when we have that value conversation based on evidence, then we're going to be kind of having the right conversation for all stakeholders in the ecosystem.
People see value in different ways, and different consumers have different sets of, preferences and risk tolerance, and so it is a complicated thing. But maybe if we could even get a dialogue going about opportunities, and then have the inventors respond to those opportunities, maybe that would get us a lot of the way that we need to go.